Today we're going to be talking about nasopharyngeal carcinoma. So where is the nasopharynx? I think that's the question we need to discuss first. So we're talking about an area behind the nose, but above the mouth. So it's almost a cuboidal area posterior to the nasal cavity and above the oral cavity. So why is this area of interest? Nasopharyngeal carcinoma has bimodal peak, meaning there are two age brackets where it's commonly found. The first age bracket is between 15 to 25 years. The second age bracket is above 50 years. WHO has been able to classify nasopharyngeal cancers into about three. So WHO type 1, here we're talking about the keratinized squamous cell carcinoma. Type 2, we're talking about non-keratinized squamous cell carcinoma that is de-differentiated. And then type 3, WHO type 3, we're talking about the undifferentiated carcinoma. So what are some of the risk factors that are involved? There is a genetic component because we see its concentration quite a bit about in the area in China, Southeast China. There is also an environmental exposure, such as consuming a lot of high salted fish that has been seen also in that particular area of the world in China. There's also a genetic component, as I have mentioned. Other risk factors that have been noted is exposure to Epstein-Barr virus. This is a virus that when one is exposed to, then it has been noted that cancers that are non-keratinized, that means type 2 and especially type 3, have a Epstein-Barr virus has a role. What does Epstein-Barr virus help us to know? Its presence will tell us about prognosis and also response to treatment. The area we're describing, remember, it's behind the nose and above the mouth. So this area is very difficult to approach surgically. So majority of the treatment that are offered in that area will include radiotherapy for very early stage disease or chemo and radiotherapy for stages that have been progressed. We can also give palliative treatment or generalized systemic treatment when the disease has become stage 4. It's important to talk about nasopharyngeal cancer because it has a high propensity of metastasizing, leaving the area where it was, going to the lung, going to the liver, and other areas in the body. So some of the signs that have been noted, number one that tops the list is a neck mass. So majority of the presentation will present as a swelling within the neck. That needs to be investigated. A biopsy will be taken and also imaging of the head and also the neck to be able to see the origin of that lesion. We'll be able to also do endoscopic viewing, looking at that area through the nose to be able to visualize the tumor and also get a biopsy. Other people present with nosebleed, others have pain that they feel is behind their eyes or behind the nose. Running nose, a discharge that is never ending through the nose can also be a sign that needs to be investigated. However, number one on the list on the sign is a neck mass. Remember we mentioned its location. Surgery is not top on the list. However, we use surgery either for recurrent disease, a recurrent neck mass that has come back, or as a salvage mechanism. Please, if you have a neck mass, if you notice your teenage son or daughter having a neck mass, kindly let it be investigated. They always have a runny nose, has nosebleed, let it be investigated. Early detection saves lives. I'll see you next for more information on cancer. Have a good day. Bye.